I usually tell people that I get to interact with that when a journalist reads a research work, what he or she does is to go to the conclusion and probably the results for the purpose of having an highlight or a screaming headline. But for researchers and scientists, we are not so much bothered about result and conclusion. Rather, we are more bothered about the methods with which the research work is done. So it is for peer reviewers, editors, and everybody involved in the process of getting evidence for people to use. So anyone interested in getting evidence is very much interested in the method used to get the evidence rather than the evidence. For us, the end does not justify the means. The means is as important as the end, and that's what method section is all about. So as a researcher, as somebody who's involved in this business of writing, you must set standards, standards of the type of manuscript you want to be associated with, the type of manuscript you want to submit, and the type of manuscript you want publication you want under your name. And one of the key aspects that will determine the standard you set for yourself is the method you use for your research and how you report it. If your method is faulty, then you cannot build on a faulty foundation, because the method of your research is the foundation on which the whole of your write-up sits on. So this morning we'll be going through what each section of writing the methods section is all about. Then we'll also go take a look at one of the guidelines for writing manuscript. I have shared earlier one of the guidelines that we'll be using for this discussion, which is the stroke guideline. I probably have mentioned in the past, there are guidelines for any form of research endeavor, from case reports, case series, conference reports, randomized control trial, all form of reports, all form of publication have a guideline that has been used. And the purpose for which this guideline came about is that people report studies in different ways. Different journals having different ways they take their reporting, and there are no minimum standards for reporting. And as such, you see a manuscript having a particular information, others do not have, making exchange of information difficult, making synthesis of evidence difficult. So because of that, a group called EQ have come together to have standards for different form of writing and publication. And today there are hundreds of or tens of guidelines for different type of manuscript that one can engage on. And it is advised that for anyone writing any form of manuscript, you should use the guidelines to guide what you write. They are all standard reporting system. So because most of the work we're going to be doing on this mentorship program is observational studies, so I've brought in stroke guideline for discussion. Like I mentioned, the methods section is the most important aspect of the manuscript. Most time you see it written as materials and methods. Now, materials has to do with, it's called materials and method because the materials are the items, the tools. When I mean tools, the entities you bring together to carry out your research, while the methods essentially speaks to the procedure and processes that occur in getting your final output of your result, that is your results. So your method speaks to what you do, the process, the procedures you carried out to get the results which you are reporting, while the materials has to do with the items you put together to get that result. So usually it's put together materials and methods. And also to clarify at this point, difference between methods and methodology. Oftentimes we use them interchangeably, but they have difference. So the methodology refers to more or less like the framework on which your research is based on, like the rationale for your study, the approach for your study. It's all encompassing of what justify your study and all of that. So that's the methodology. But the method itself has to do with the process or procedure by which you get the study done. So method is a subset of methodology, but many times we use them interchangeably, methodology and methods. So the method is like your study SOP, like I mentioned, is the standard operating procedure of your work. It gives step by step what you did and how you did it to get the result you are presenting to the world. And it should be such that it is clear enough for anyone that is knowledgeable in your field to be able to replicate what you've done. If you describe a method section in such a way that someone has to call you and say, sir, how did you do this aspect of your research? It means your method has not been clearly described well enough. So your method should be such a way that anybody who is of average knowledge in your field can take your paper and be able to replicate what you've done. Sometimes your supplementary documents to your manuscript will have more detailed explanation of your methods to help people to replicate what you've done. But at least you should give the minimum required information for your study to be able to be replicated. So you have to describe it so explicitly that it can be replicated, like I mentioned. I mentioned this earlier. When a manuscript is rejected, usually the process of peer review and getting paper to publication passes through different stages. The desk review is done, then it goes into peer review, then back and forth, acceptance, correction, and finally publication. So most commonly, the reasons why a manuscript will be rejected at the level of the editor, handling editor, one is if it's not within the scope of the journal. Secondly, is if the method is found to be flawed. If the method does not align with the objective of the study, then they would throw your paper away. So usually, because once you do a study, once you carry out a study and the method is faulty, you cannot redo the procedure. I mean, it's not like an aspect where you can be asked to rewrite this aspect. Once the method is flawed, the whole foundation of the work is bad and the work itself cannot be accepted. And usually we keep moving the paper from one journal to the other and rarely get acceptance for such a paper. So it's important when you're planning, when you're designing a study, ensure that your method is done, you use an appropriate method in doing your research. And also when you are reporting it, report it in such a way that what you did is clear and it shows how it is relevant for the question you're trying to answer. So what are the subsections of the method section, methodology section? We have the study design, and I'm sure we've had a conversation on different types of study design, cohort studies, positional study, case control study, all the form of study design are expected to describe the study design. If your design, like I mentioned earlier, is not appropriate for the question you're going to answer, then whatever you find in your study is null and void because the method with which you answer the question is not appropriate. For example, if you are attempting to answer a question on etiology of a clinical condition, one would expect that you do at least a cohort study or a randomized control trial to determine the etiology of a condition or the prognosis of a condition. But when you use a case report to state definitively that this condition is caused by this particular factor, then that is faulty. Reviewers are going to spot that and probably reject that paper because a single case report cannot be used to say definitively that A causes B. The same thing with a cross-sectional study. In cross-sectional study, inherently, there is a difficulty in determining whether the exposure comes before the outcome, or the outcome comes before the exposure, because you are taking the two as a snapshot at the same time. That will mean that you cannot definitely say that A causes B in a cross-sectional study. Of course, there are certain situations where you may be able to make such inference, such as congenital anomaly, in which you can easily say what comes before the other. But more commonly, you really will be able to say what comes before the other in a case control study. Another important aspect is the study settings. Of course, when I start going through the stroke guideline, I'm still going to come back to all of these components, but just to paraphrase all of this first. So the study setting is important when you're reporting your methods. A research that is carried out amongst hospital population is different from the research that is carried out in the community. Your findings, in terms of generalizing your findings, there's a whole lot of difference between a research that is carried out in an hospital setting and the one carried out in a community setting. And it's important to highlight this in your description of your method section. Similarly, the population that is studied is also important. You need to be able to know your study population. The reader wants to know what group of people were studied, which people were excluded from the study, which group of people were included in the study. Then, of course, we know the importance of sample size in validating a research question. If your sample size is not adequate to answer a question, then whatever you find, you can only make an exploratory conclusion. You cannot make a definitive conclusion on your finding. And the sampling procedure is also important. It plays an important role in knowing what level of bias is involved in your study. We all know that a probability sampling is superior in terms of reducing selection bias compared to non-probabilistic sampling. So these are questions that readers want to know when they read your manuscript. And you must be transparent in telling the reader what exactly happened in your paper. It is a transparency that encourages people to read your paper. You should not hide behind ambiguity to cover up deficiency in your paper. You are expected to mention all that happens in your research work, so that whoever is reading your work can base their judgment on what the setting the research takes place. The sample size that was used, they can use that as a basis to decide, oh, there's a need for further study based on the small sample size that was done in this particular study. Remember when we discuss research gap, one of the things we talk about is the methodological gap, in which when you look at the study design, the study approach and all of that, you'll be able to identify a gap that needs further exploration in future studies. So that is why, as a researcher, when you are writing your manuscript, we expect that you state all of this clearly. Also important is the study procedure. And like, remember that I mentioned that for every study, for any manuscript, your manuscript should be done in such a way that it can be replicated. So when you do like an interventional study, you should describe in specific terms what you did in the step of your study. So for example, if you're administering medications to a population, let's say you're administering an antiretroviral drug to a population, you must, in your study design, in your methodology, discuss what medications you give, the dose you give, the way you give the medication. The patient need to fast before they take the medication. How long after taking medication do they need to rest, and all of that. All those important aspects of the process of administering a drug must be reported. Again, the important aspect will also be based on the knowledge of the field where you are doing your research. You know the things that somebody that needs to replicate your study needs to know. So a non-professional may not be able to identify the key aspect, but when a reviewer that is knowledgeable in your field reads your paper, they were able to identify, oh, what exactly is missing in terms of description of the procedure, or what is sometimes when authors write, it sometimes give too much information, and sometimes you may be asked to skip some information when it's seen to be redundant, but you should give just appropriate information as required for participant to, sorry, for your colleague to replicate your paper. Your variables that you use in your study must be clearly mentioned. Many a times you read manuscript and you cannot really identify which manuscript, what each variable is doing in a particular study. They're expected to mention, oh, in this study, the outcome measure is this quality of life after antiretroviral agent, use of antiretroviral therapy. Then the explanatory variable or the exposure variable is use of second generation antiretroviral agent. Confounders is age, sex, all of that. Potential confounders, you're expected to list all of them. Covariates, you're expected to list. All these should be clearly mentioned in your study. Just to mention at this point also that when you're writing your method section, you remember that you have a proposal, then you have the manuscript that you're writing. You should, if there's a difference between what you propose to do in your proposal and what you eventually do in your research itself, you're expected to mention those differences and explain why the difference occurred between what you proposed and what you eventually did. Then you should also mention the statistical tools you use for analysis and the analytical method you use, the statistical method you use. Now, when people ask, why do I need to explain, or why do I need to mention the tools? Why do I need to mention, oh, statistical package, SPSS was used, 24 was used, SPSS 27 was used. What's the essence of mentioning the version and the statistical tool that was used? The reason why you need to mention is that each statistical package has some limitation they have in terms of the level of statistical analysis they can do and the type of assumptions they do, except you make adjustments. So for SPSS, there are some default settings. And once you use SPSS, this is the type of analysis you expect it to do. Some assumption, all statistical analysis have some assumptions behind them. And sometimes you need to vary the assumption between what is default and what you want to use in your study. So once you mention that I use a statistical package, a particular version of statistical package, we already have an assumption that this is the type of analysis that was done, except you now mention in your method that, oh, this particular adjustment was made in terms of this baseline parameter, in terms of this baseline analysis, then the reader will be able to know, okay, it is not the default one for this package that was used. It is this adjustment that was used at the end of the day. So that's why you need to mention the tool you use for your analysis. Then the method of analysis, of course, this is clear. We've mentioned it in previous, especially when we did quantitative research method of statistical analysis. We know that different analysis is appropriate from different types of variables that we make use of. And the one thing to note about statistical packages and tools is that irrespective of the type of data you present to it, whether parametric or not parametric, once you provide the data, it's going to give an analysis for you. Now, if you do not state the type of analysis you did, and you do not state the type of data you have, whether it is normally distributed or not, and you just do a form of analysis, you may be using an inappropriate type of analysis for a particular data, and the results you have will not be valid. So the reader wants to know, is your data normally distributed or not, and did you use the appropriate tool to analyze it? Of course, an important aspect of your method section, which you must report, is the ethical consideration you made in your study. What are the, did your study have an exempt, or it had a football review, or it has a, was there an exempt, was there a football review, or it was a, sorry, that skips me. One of the three types of review that was done for the study, the reader wants to know what were the ethical consideration you made when you are doing your research. It needs to be stated. Was your protocol registered before you start your study? All of these need to be reported in a methodology section so that the value, the ethical consideration that was given in your study is clearly stated in your study so that whoever is reading your paper puts that behind their mind when they are reading. And when they have concerns, they know that, oh, these concerns have been reviewed by ethical board, standard ethical board, and they found it not worthy of concern. So these are things you should reflect in your method section. Now, let's take a deep dive into the stroke checklist. And the stroke checklist is essentially what we've been discussing so far. But we're now going to be doing a more detailed assessment of each aspect of the stroke checklist. What I'll be saying now will be more like a repetition of what I said earlier, but to emphasize some aspect of it. Just to talk about the stroke checklist in general and how you can make use of it. Now, when you're writing a observational study, it is expected that you have your stroke checklist by your side and you look at each section you are writing, compare it to the standardized checklist and know that you meet that standard. Sometimes journals have their peculiarities of reporting. So if the journal has their own peculiar description of how they want a session to be written, of course, you defer to what the journal wants. But usually your journal will not deviate so much away from the stroke checklist. So probably is in terms of number of words, number of paragraph, number of components that should be in a particular section that they may differ. But essentially, this checklist will be like the background with which you now build your write-up. And also, as a reviewer, many a time what we do is when we are reviewing a manuscript, we take the checklist and use that as a template to see whether the manuscript has the minimum standard to be accepted for publication. I've extracted the method section of the stroke checklist for this conversation. If I'm not mistaken, the stroke checklist has about 22 components to it, out of which about 8 out of the 22 speaks to method. That shows the importance of the method section. The other aspects, results, discussion, introduction, abstract, title, conclusion, share the remaining aspects. So about a third of the checklist is speaking to method. That shows the importance of the method section. Now, in terms of study design, which I mentioned earlier, we must discuss the study design in detail, mentioning the key elements of your study design. And if there is a deviation from the usual study design, for example, standard study design includes, I'm going to talk about observational study. It includes case control, core study, cross-sectional study. But when you now have a study design that deviates away from this standard, there are modification of all of this. For example, if you are doing a case cohort study in which it's a modification of the standard cohort study, then you should explain the deviation and why you are taking that deviation and what constitutes that case what makes it a case cohort study and not a straightforward cohort study. So those are things you should describe in study design. Another thing I think I should mention here is the use of the word prospective and prospective study. The use of these words are something I'm sure many of us must have come across in literature. The strobe checklist, the strobe guideline advocate against using those terms, retrospective and prospective study. And the reason is clear. Different people have different interpretation for what prospective and retrospective study refers to. For some people, retrospective study refers to case control, while cohort study refers to prospective study. For some, the distribution is just about timeline of collection of data. If you collect data previously, it is retrospective. If you are collecting it forward, it is prospective. And for some, the usage of the two words is based on the fact that the case control study, the exposure of interest is collected in retrospect, while in terms of prospective, the exposure is collected prospectively. So the use of prospective and retrospective is used to mean different things by different group of people, and that's why Stroop guideline, rather than mentioning retrospective and prospective, rather you mention the study design and mention how the data is collected. Another example, another way of describing whether it's retrospective or prospective is to say whether it's concurrent or historical. Historical refers to collecting the data retrospective, while concurrent also refers to prospective data collection. But like I mentioned, Stroop guideline advice that we just mentioned whether it is case control, cross-sectional, or cohort study. But so that will not cause confusion, remember that there is a particular type of cohort study, a particular description of cohort study that speaks to whether it is prospective cohort or retrospective cohort. That's a different classification. But what you most time will see that this is a prospective study on a group of people. That does not really connote the study design, and we should avoid doing that. If it's a cohort study, you can actually say a retrospective cohort study to reflect that particular type of cohort study. But stating that a study is a retrospective study does not exactly communicate exactly what was done, and it is advised that researchers avoid such ambiguity when reporting study design. Now, the next important thing is the study setting. The study setting is describes where I mentioned this earlier. Where exactly did the study take place? Did the study take place amongst persons in prison? Did it take place among persons in adult home? Did it take place in a school setting? Is it in a community setting? Is it a hospital setting? These informations are important in interpreting the results you are going to be presenting to your population. So you need to clearly state the setting where your study is done. Of course, the location where the study is carried out is also important. The relevant date. So it's not enough to say that you carried out a study, a cross-sectional study in Lagos. You must also mention the dates where it is carried out. So, for example, between December 2024 to January 2025. So that gives a timeline, and when one is going to make a comparison in terms of period, you're able to know that, oh, this study was carried out, the data collection for this study was done in this period. So we can make a comparison between pre-COVID era and post-COVID era as an example, because there is a particular time, the time interval when the study was carried out was mentioned. So these are important information that you should mention. Also, how your exposure was defined. Follow-up may not be relevant for a case a cross-sectional study, but when you are doing a core study, then you must describe how you follow up the patient and how the data was collected. Is it a patient-reported outcome? Is it patient that provide the data? Do you have to go to the community to collect data? All of this must be clearly mentioned in your reporting, in your method section. Now, the variables, like I mentioned earlier, you must clearly mention what your variable is and how you define your variables. Are you defining your variables based on WHO definition? Are you using the United Nations definition of a variable, like in terms of, or you are using your society definition of outcome, or you are using as described in a previous study. You remember that one of the biases that can come into a study is information bias, which has its own sub-component. One of it is misclassification. So if the definition of outcome is not, of your variables is not clear, then there can be misclassification of your both your exposure and your outcome. So this is a key aspect of your reporting system. You must clearly discuss how you define your outcome. You also mentioned how your confounders are described. What were the confounders you used in your study? What were the colliders, if there are any? Each component that you will be using for your analysis, you must mention how you are going to assess for them and how they are described. Then you must also mention the source of your data and the measurements. This is important in order to be able to compare variables at the end of the day. If you want to make comparison between your own variable, the variables you are using in your study, and feature variables, feature and different studies, then the type of measurement that was done should be mentioned. Remember that when we do things that are abstract, like quality of life and things like that, there are different tools that can be used to measure the same variable. So we need to know which one exactly you are using so that there can be comparability between the assessment methods that were used in your study. Then bias cannot be overemphasized. And there are different types of bias. I mean, this class is not one to discuss the different type of bias, but we know that bias can be divided into two or three major groups, depending on how you look at it. We have the selection bias, the information bias that has several subcategories, and you have the confounders, which treats purist statistician will tell you confounder is a group of its own and not a form of bias. So you must clearly state how you attempt to reduce bias in your study. So for example, you may have to have two persons reporting an outcome and taking an average to reduce reporting bias. So whatever you do in your study to reduce reporting bias, you must describe it so that when a reader is going through, he knows that you've made some adjustment to control for bias that are inherent in your study design. And this must be reported if you did any. Then sample size. Unfortunately, you're going to come across many manuscripts in which how the study sample size is obtained is not described. There is going to be comment like 200 persons were reviewed in this study. How did 200 come about? Did it fall from the tree? How exactly did you arrive at 200? It's usually will not be reported in many manuscripts. And if you want to report in a Q1, Q2 journal, like we aim to have our paper be reported, then it is expected that you report exactly how your sample size is arrived at, what precision you assumed, what assumption did you make about the prevalence of the outcome you are studying, what level of significance are you working on, what power do you want for your study. These are things you're going to mention in your study. And you don't need to put the formula, you write it in prose in order to achieve a power of 90%, allowing for a 5% level of significance, giving the prevalence in previous study of 5%, and assuming a precision of 5%, we arrive at a sample size of 253 participants. You make adjustment for 5% loss to follow up or non-responder, and this gives us a total sample size of 270. So that is how you are going to describe your sample size in your study. And for any study you are doing, you should report this. This is important for readers to be able to know whether your report is appropriate for the type of study. Your sample size is appropriate for the study you've carried out. So when you read your next paper, look out for this description. I'm sure you're going to see many papers in which they just write, we enrolled 200 participants for this study without an explanation of how exactly they come across that sample size. Yeah, of course, an alternative to do, especially when you're doing a pilot study. When you're doing a pilot study, you may not describe a sample size, but you can actually describe the power after you've done your study. It's more of a post hoc analysis that given the total number of persons are included in this pilot, this is the power of this finding. Now, this is not encouraged. Even for pilots, there are ways of attaining sample size for pilots. Some will tell you to use 10% of the sample size you expect to use for your main study for doing your pilots. There are different rules of thumb that are used for that. Some will say use 30 as a 20 to 30 participants for your pilot. So if you are doing that, you're going to report it that using the rule of thumb of 20 to 30 for pilots, this is the number of sample we intend to use for this study, and we did this. But if you do not do that, a post hoc analysis can also be done to report power of your study. But for strobe pitches against using post hoc analysis to describe the power of your study. Sorry. Now, how do you handle your quantitative variables is also an important aspect of your reporting. Remember that you can collect quantitative variables at different levels. You can measure it as a nominal variable. You can measure it as ordinal. You can measure as interval or ratio. So the level at which you report, the hierarchy at which you report your data is important. Whether you group your data or you reported it as continuous variable is important for the reader. So if you collect a variable as continuous variable, remember that analysis of continuous variable gives you a lot of power in terms of the validity of your findings compared to a group variable. If you are grouping your variable, you should tell us the justification with which you are grouping. For example, it's easy for me to group variables by age group into infant, toddler, preteen, teen, and till the age of 18 if I'm working on childhood. Or if I'm working on general population, I can describe as child, adolescents, early adults, mid adults, and there are ages that this correlates with. So if you are grouping your data into this group, it's a meaningful grouping that you can do, and you should report how you group and the basis for which you do that grouping. Sometimes is for interpretability and to make it relatable to what your professional group have been doing in the past. So you should give explanation on that. Then the statistical method you used should also be described. How you handle missing data should be described. There are different ways of handling missing data depending on the type of missing data. And there are mechanisms of missing data, such as whether it is missing at random, missing not at random, or missing completely at random. These are statistical tools that your statistician will be able to assess for, and you should report how you handle your missing data. Again, when I was talking about statistical packages having their own assumption, so missing data is an example of that. So if you are using SPSS, SPSS handle missing data by doing complete case analysis. And what does that mean? Once you have a missing data, it completely removes all the missing data and analysis for you. So if you say you do analysis with SPSS, I already make an assumption that it's complete case analysis that was done, except you now mentioned to the reader that you made an adjustment to the type of analysis you made use of. Maybe you did multiple imputation, or you did single imputation to address your missing data, different forms that you can use. If you did a subgroup analysis for your study, you should mention it in your methodology that you plan to do it, and this is what you did. If anything you did in your study is exploratory, then you should report it in your method. And these are key things that would be important for readers to be able to make assessment on the validity of your reporting. So that's, in essence, the stroke checklist for cross-sectional study. Like I mentioned, there's stroke checklist for case control and core study as well, which you can use when you're doing observational study. So rounding up, remember that your method is a description of what you've done already. So you should not be seen writing your method in present tense or in future tense, because many times our method section in proposal and in methodology in manuscripts are almost exactly the same. Most times they will be the same. If there will be any adjustment, it's going to be what change between your proposal and the work itself that you're going to add into your method. Otherwise, if you did exactly what you proposed to do, then your method section is going to be essentially the same thing. So many a time people copy their proposal methods and put in their manuscript, and as such, you'll be seeing future tense in their methods. That should not occur. Your method should be written in past tense because it assumes that it is what you've done already. In terms of tools that I use to collect data, usually Prof will emphasize this over and over and over. When you are using a tool to collect data, you must use a validated instrument, an instrument that has been shown to be appropriate for the study population in which you are studying. So you cannot use a tool that was, designed for the Caucasian on a Black population when there are inherent difference in those two populations as related to the outcome you are measuring, except it has been validated and found to be effective in that population. Doing that means that your finding may not be answering the constructs you are trying to answer. So use a validated tool. If you do not have a validated tool, then you must do an initial validation of your tool for the population before you now make use of it for that population. And there are ways of assessing the validity of a tool doing the Cronbach alpha analysis of the. So what Cronbach alpha does is to look at. So if I have like 5 questions answering questions about a construct, I want to see how much of correlation exists between those 5 in terms of the construct I'm trying to answer. If there is a particular question that is not correlating with other ones, then I may decide that, oh, I'm going to remove this question from, that's before I deploy it. That's a testing that during the validation, before I go into the population to use the tool, I remove this question because this question is not helping to answer that question. So for example, this is a fictitious sample I'm just bringing up right now. So I'm trying to look at nutritional pattern for a certain population. So I'm asking the population, how many times do you take oats in the morning in a rural community in Nigeria? You agree with me that asking the question on oats from rural population would not be valuable in that population. So by the time I do the validity, I'm sure oats will not be helping to answer that question. And I will remove that question on oats from that question before I now deploy it to the population I want to use. And in reporting my method section, I'm going to mention that, oh, this is the tool which I validated, and based on the Cronbach alpha score, this particular question was removed before it was now finally deployed in the population. So those are the type of things you are expected to do before this type of process is called adapting a tool for your own purpose. But sometimes when you check a tool and it works well for a population, you can just adopt it as a whole. and you're going to mention it in your reporting system. I think our time is fast spent. Okay, we'll still have some time. Then when you when you're doing clinical assessment, it's also good to improve the reliability of your finding, to use more than one or two persons to assess that outcome. Then you do inter-rater and intra-rater reliability tests to see how well the assessment between two raters correlates with each other. So this is this slide has been shared. We can go through this short read to understand validation and reliability of data. With that, I will thank you for listening and take questions from us. So if there are questions, we can unmute and ask questions or use the chat box. Hello, I hope I've not been speaking to myself.
Yeah, we can hear you, sir.
Okay, all right.
We'll be following.
Okay, thank you. So any question, anything to clarify? Like I mentioned, the most important aspect that a reviewer is going to check about your manuscript, even before they send it to reviewer, an editor is going to check before they send it to reviewer, is your method. And when it gets to the method, to the reviewer itself, the first thing they check is a method. And actually the method section, despite it being the most important, is the easiest to write because you have templates to writing your method. All you just need to do is carry the appropriate guideline and start looking at each of them and see how you want to replicate the guideline in your own work. So by doing that, many times when you're doing your research work, once you have your research question, you have your objective, you can write your method even before you write the introduction and the other aspect of research. Many times, many people write their method as the first section of their writing process because one, it's simple to write because there are guidelines and it's something you've conceptualized at the beginning of your study. Okay, there's a question on the chat box. When you talk about data, so exactly, yes. So you can be talking about enhance, DHIS, wherever you're sourcing for your data. If you are using a data tool, then you must mention the data tool, which year, which version of it. You're going to describe the tool that you are using for your in your methodology section, this tool you are using for your study. So for some of us that will be using maybe APIN database, you need to describe that database clearly. And if you are using a database that needs authorization, you must also mention in that method section that you got an approval to use a database. Remember that databases there are different level of accessibility. Some of them are fully free and accessible and you're allowed to use them freely. Some of them you need to get permission to use them and you must document the permission that you have. Usually, many manuscripts will ask you to have a supplementary data where you describe more details about your method section, what exactly you did. But the ones that must appear in your manuscript is that one that gives the minimum information for someone to be able to replicate what you've done. Dr. Isa, is Dr. Isa on the call? Okay. If there are no questions or clarification or comments, I guess I will have to give us about 10 minutes of.
Dr. Kutus, a question just dropped.
Okay, yeah. Okay, yeah. Thank you very much. I did not get this bit. Is the Cronbach alpha analysis done before data collection or after regarding construct? Is it your own question that you test or the okay, yeah. So this is a beautiful question, and let me explain further. So this is it. When you have a tool that you want to adopt or adapt, you want to validate it, you deploy that tool to a group of people. That's like a pilot assessment. So probably you get about 30 people to use that tool that you want to assess whether it's valid for your own population. So when you get the answer, their responses, you now SPS, all the statistical tools have it. You now use your statistical tool to measure the Cronbach alpha for that tool, using it for each of the constructs. By the time you do it, it's going to give you the percentage correlation between it. For the ones that have, I can't remember the threshold now, I think it's 0.8. The one that have the threshold below the recommended one, for the ones that are affecting, there is a way you have your overall Cronbach alpha, which shows how much your construct, the questions answer the construct you intend to answer. So usually you can state that if a construct is greater than 0.8, then you can adopt it for your own population. But if it's less than 0.8, then you probably need to make adjustment. So in terms of doing adjustment, you can now do a sub Cronbach alpha, in which if you remove one question, how does it affect the overall Cronbach alpha? So SPSS or any statistical tool will not give you, if you remove this question, what happens to it? Does it drop the Cronbach alpha, or does it improve it? So it checks for each of those questions. It checks for each of the questions you have under that construct. So when you remove a question and you see that it improves the Cronbach alpha, then probably that question should not be there. But when you remove it and there is no change in Cronbach alpha, then you retain that question. Then you do that for all the questions that are answering a particular construct. So let me give an example. If the construct is willingness to attend APIN mentorship program, that's what I'm trying to assess. So, and I ask questions like 5 questions. I'm so excited. I'm so excited to attend APIN mentorship program. Agree, strongly agree, disagree. My work schedule does not allow me to attend the program. Agree, disagree, and all of that. So I asked like 5 questions on willingness to attend APIN mentorship program. So by the time I'm doing Cronbach alpha, I'll remove one question and see how it affects the overall Cronbach alpha. If I remove my work schedule and I see that it drops my Cronbach alpha, then I'll return it because I think it's important. But if I remove the program occurs at time of school runs, and I see that is significantly increase my Cronbach alpha, then that question is not important. I'm going to drop it. I hope that answer. This is done during validation before you now deploy the adapted to the population. So I hope that answers your question. That's Dr. Azuka. Okay. So there is this. Are participants allowed to unmute? Faida?
Yes, sir, participant can unmute.
Okay. So the second question here is, if the tools you want to use has not been validated in your setting, but looking at it, the question applies to your setting, will you adopt and use, or you must validate before use? The ideal thing is to validate it for your population. Once the tool has not been validated for your population, you cannot really say on the face. So there are different level of validation. We have face validation, construct validation, criterion validation, and a fourth one that I can't remember now. So you can do face validation, but face validation is the least level of validation. You need to validate it doing this analysis before you can really say that it's useful. Of course, it doesn't mean that if you do not validate your paper, you will not get your work published. But when your target is Q1 journal, then you need to do all of these peculiarities in order to be able to get publication in those high-ranking journals. A lot of times they're going to ask the question that, was your tool validated for the population you are using it for? If your tool has been used in a similar population, then you can use that tool. So for example, I'm using HRQOL, that's health-related quality of life, to WHO-related quality of life to evaluate quality of life amongst pregnant women in ERA. I check for validation and I can't find, but I see that it has been used successfully in Lagos. I can make reference to the fact that using the tool that was used in Lagos for this similar study, I'm using HRQL for this same population because it has been used in previous study and it has been found to be effective. So those are things you can use. But if it has not been used in that setting, you are doing a novel work and you cannot just awesomely carry a tool from another population and just dump it on your population and use. The finding may not be valid at the end of the day, and it may be difficult getting it into a Q1 journal. Okay, I think that may be the last question. We still have 4 minutes. Okay, I don't know if Prof has been able to join. Okay, I think she's not able to join. All right. So we can continue the conversation on the chat box if we have any clarification to be made on what I've been presenting. Once again, thank you everyone for being a wonderful listener. Do have a lovely weekend.
Thank you.